You're welcome back to the Pulse on the Joy News channel on Multi TV. Now, let's move to the health front, where some patients have been left stranded today as pharmacists across the country's public hospitals stage an indefinite strike. They're protesting government's failure in addressing the discrepancies in their market premium. Joy News' Joseph Akabley visited the Kolebu Teaching Hospital on day one of the strike and now reports on how patients are affected.
The signpost that directs one to the main pharmacy here at the Kolebu Hospital. Now, if you arrive here on Monday, one thing that you can't help but notice is that you have some inscriptions posted on the main entrance to the pharmacy. Now, I'm just going to try to see whether the door is open or not. You can hear the sound of the door refusing to move. It's been closed with a notice here that says, "Dear customer, due to the ongoing strike action by the Government and Hospital Pharmacists Association, we are unable to provide services until further notice. We regret any inconvenience caused." So this is the notice at the front of the main entrance to the Kolebu pharmacy here. The message is very simple. It's telling many customers who will be coming here Monday to purchase drug that they are closed and they are not working, and it has to do with the strike action. They have some grievances about market premium as well as the pay grade structure that they want government to address, and until that is addressed, they have laid down their tools and they won't be working until government hit to their cause. Now, as it stands, the pharmacy is closed, so it means that the hundreds who may be coming in to purchase the medicine, they may have to try other private facilities that provide same services, because for the government pharmacy, they are simply not working. So I'll be hanging around for some few minutes, talk to some customers who will be coming in to purchase drug as well.
I came here for some x-rays and come back and some medicine, but unfortunately we came and they've locked down. We don't know the reason why. I don't know. I'll go outside and buy my medicine. That's what the only option I have, because apart from that I don't have any option again.
Came here to buy medicine for a friend of mine from China, Protein and Lamisil. Yeah, and they've closed, and I don't know the reason why they are not working. And this is very appalling. If I would have to go out and buy it, how can the Kolebu make profit? And also, when they are on strike, what is going on? Then that means the government must do something about it. The government must meet their demands and also make sure they are okay with what they are doing here. If they come here, this is what they do for a living. So when they come here and the government don't meet their demands, that means there's something wrong. So the government should do something about it. I don't know if it's the authorities of Kolebu who are causing this, or it's the government himself who is not satisfying them. So something must be done about it. I have to go out and go and buy this, and I know this is Kolebu, and I was very sure I'll get this here, and now I'm here and it's closed. I don't know whether I'll get it outside or something, or maybe I would have to go to 37 military hospital, whereby I'm also traveling this morning with him, and it's not good at all. So the government must do something about it. Very, very bad.
Honestly, I'm not so happy about this because it came as a shock to me. I just came in to get some drugs, and then the pharmacy is on strike. Anyway, it may or may not affect me to an extent, but I think the drugs here are less expensive than what we have outside. Okay, so it will affect me economically and at the same time my health, but I can get it outside. But what about the patient that cannot get the drug outside because of an increase in cost or something? And about those ones who need to be supplied regular medicines almost every day, what are they going to do about it? So whatever the issue that has prompted this one, I think the necessary cortex should find a way of solving the issue so that they'll come back to us. We need our pharmacists back.
So we have seen the pharmacy close. We have also heard from some customers who came in to purchase drugs from the pharmacy, and unfortunately they had to move elsewhere. I'm now going in to speak to Mr. Raymond Tete. He's a former GOSPA chairman, to give an indication of the kind of services that the pharmacies across the country in the various hospitals provide for the many patients, as well as others who go in also to purchase medicine.
The pharmacist is a highly qualified health professional, 4 to 6 years university training, and then an internship for about a year or two in a tertiary care institution to enable him to develop specific skills as far as drug medicine use is concerned. Basically, they are the experts, ensuring that drugs in use provide the necessary efficacy, the expected outcomes are achieved. And then also they make sure that the medication errors are reduced as as far as possible. They make sure that there is maximum benefit of medicine used to patients, while also minimizing the possible side effects and then, untoward effects of the use of medicines. They educate the general public on information concerning the use of medicines. They also produce what we call small-scale manufacturing in the hospital. For example, in Polibu, we provide all the disinfectants in use here. So every disinfectant, which would have cost the hospital so much, we produce it. We also ensure that patients receive the necessary knowledge to enable them to use medications properly. It's empowerment. Without knowledge, our people perish. So we make sure that with the requisite knowledge, patients can adhere totally to their medications. We are also taking care of patients with chronic diseases, hypertension, diabetes, HIV care, etc., etc. In short, the pharmacist is crucial to the healthcare delivery system of our country. Without the pharmacist, we are in trouble.
So the gospel strike is on. If you are on your way to a pharmacy in any of the government hospitals across the country, what you should know is that for the many workers, they are no longer working. They are making certain demands of government. They want government to address the market premium, and until that is addressed, they've laid down their tools, and it can be felt here at the Kolebu Hospital, where many customers have come in to purchase drugs, but unfortunately, they can't get the drugs. Joseph Akable, Joy News, Accra.
Now, this report was filed in the morning, but in the last few minutes, we're learning that the Health Ministry has intervened in this matter. In fact, they have called the leadership of GOSPA to a meeting to resolve this matter as soon as possible. We can speak to Stephen Kokwe, an executive member of GOSPA. Mr. Kokwe, good afternoon to you.
Good afternoon to your viewers.
And thanks for joining us today. What's happened since you took this action?
Actually, before this action, we were supposed to have some meeting tomorrow. We've just been called that the meeting has been postponed to Thursday because one of the crucial players who was supposed to be part of the meeting is not available. We are just hopeful that these issues will be addressed as quick as possible so that we can actually come back to work and then attend to our cherished customers.
So if I get you correctly, you're saying that the meeting that was supposed to happen today did not come off?
Yes, it didn't. And another meeting was supposed to have come tomorrow. There's another meeting too that's supposed to come on Wednesday within the National Labour Commission and the Fair Wages and Salary Commission Board. That one we are not part of it. But the meeting that's supposed to come tomorrow has also been postponed to Thursday. We're just hearing from the ministry that one of the key stakeholders couldn't attend the meeting tomorrow. So that has also been scheduled for Thursday.
So will that mean between now and Thursday when you meet the leadership of the, be it Fair Wages or the Health Ministry, your strike continues?
Well, unfortunately, that is the position that the general membership have actually embarked on since their annual general conference. And that has been stated because of the long period that was supposed to be used to resolve this, either to an issue by law. It's supposed to be solved within 14 days by the labor law.
Because some will look at your action and say, if there are already overtures for meetings to happen in resolving this matter, why not pull the plug, do the negotiations, and then come back when things don't go your way?
Yes, it has always been back and forth, and even at a situation where the National Labour Commission has actually taken action and the implementation is supposed to be done. We were told then at the last hour that it cannot be implemented. For obvious reasons, we don't know. Even the cabinet subcommittee that was set up by the government to also look into our matter also gave their recommendations. And after that, there was a roadmap for the implementation. We were told that the roadmap was stalled somewhere around the Ministry of Finance, and that also never came to fruition. So it has been this back and forth frustrating pharmacists. As I speak to you now in Kolebu, this year alone, we have lost about 10 pharmacists. A lot more will be leaving to the private sector. And that could jeopardize the pharmaceutical care in the public sector. So me and you, our safety in terms of medicine can be affected.
But again, Mr. Kwakwe, you look at the problem from your end and the bigger picture for its ramifications. But are you considering the many who've been to Kolebu, for instance, today could not get the drugs that they would not find on the open market because of your strike?
We have always considered that. And that is why we have had this patient, this painful, sick patient for all these 7 years. We go back and forth. Government says, okay, your issues are legitimate. Let's go back to the negotiation table and talk about it. And we have not gotten anywhere. And you should understand that our members have also been very, very, very patient. I don't think you working in Joy FM, you could have this patient for 7 years, talking about your conditions of service and talking about...
Mr. Kwakwe, the difference here is this. For the service you provide, it's a question of saving lives. Mine, I'm sure someone else can do it. So is it also an issue where you strike the right balance in taking a decision that will not hurt any of us and not see lives lost as a result?
You see, that is why we have had the opportunity. We have always given the government this long rope because we know that our actions may affect the patient. Unfortunately, we have been pushed too hard to the wall, and that is also affecting the provision of services. As I speak to you now, our members, their salaries have been reduced when they were migrated onto the single span because this thing was not corrected. Their pension has been reduced, and who will continue to provide that service? Yes, he will come to work with that phase, but if you don't take care, he will not be able to provide that effective, what do they call it, service that will make sure that your safety in terms of medicines are. So we are concerned and we think that, look, this is the time to act. It should be acted right now. So I would like you to ask the question to the employer, why this long wait? They have to take the blame. We're not we.
Now, talking of negotiations and the timing for the questioning, some would say your decision is coming at a time when we're close to an election. You're trying to force government's hand to do this. What would you say to them?
It's unfortunate that such a notion or such something like this can be attributed to the election. We could have started it before in the beginning of the year or in the middle of the year. But we have had that patience. We thought that, look, let us look at government reaction again. Let us look at the government situation. But we have realized that we are not getting anywhere in terms of, and therefore this time around, this decision was taken at an annual general conference. And that decision was taken based on the fact that for all these years, we have had this back and forth trying to resolve the issue. And we believe that it is not an issue about the election year, but it's an issue of the fact that this issue has actually come too long for people who you consider them as essential service providers.
Mr. Kwakwe, thank you for your time this afternoon. An executive member of the Government Hospitals Pharmacists Association, GOSPA, speaking to us on an update. Clearly, a meeting that was scheduled for today with the Health Ministry and the Wages and Salaries Commission did not come off. That will be done on Thursday, but he's made it clear that up until that moment, if you're thinking that meetings will mean they will withdraw their decision to strike, well, they won't. That will mean that if you need care at the hospital, especially at the pharmacies, for some specific drugs you want to get on the open market, you might as well say you're on your own for this issue. We'll see what the Health Ministry does on the story later on. But let's move on from one problem in one sector in health to the power sector. Well, today, thousands of Ghanaians for a second time in less than 4 days are bearing the brunt of striking workers of the ECG as access to their services has been impossible. Hundreds have thronged the entrances of the district offices in parts of the country to buy prepaid credit, have their faults fixed, and pay their bills. Let's gauge the impact now. Komla Adom has been to some of the offices of the ECG here in Accra, joins me in the studio with more. Komla, which offices did you go to and what did you find?
I was particularly at the Avena office here in Accra, where about 15 or more people were seen hanging around the ECG office, just waiting to patronize some ECG credits. Some were also there in order to pay their bills. Others told me they were there to change their meter remote controls, while a few others too had told me that they had just come there to, confirm for themselves whether indeed the ECG was on strike. So, in fact, there were a number of people who were around there expecting to access the service of the ECG, but for some reason were not being attended to because of the strike action.
Okay, let's hear from some of the customers who could not get services today.
They said they are not open a shop office today. They are not going to open it because they are on strike. So I wanted to go back. Okay, now my boss sent me to buy credit, and we are working Infinity Ties. So that's the thing that I wanted to come and buy.
How disappointed are you?
Okay, I myself, I'm feeling bad because his daughter and his wife, they are all in the house and no lighting.
Me babe change na me koto me electricity but me call no ma block old remote and I'm say memra office I'm say me call avino me call avino no no mo nya djuma and ma ba main office na also mo nya djuma obi say I'm say I'm go strike and am I stranded the hu dey me try me share there I'm say bi no say e bi at 12 o'clock and e bi a one be sign a resume enti me try go see 12 o'clock say bi a me so enya me pa with that light no me ne ma be be say anything.
Clearly, some people need the power, but they're not getting it today because of the strike by the ECG workers. Well, Komla, did you get to speak to anyone from management on this issue?
No, unfortunately, when we got there, all the management members were unavailable. Even the workers themselves were unavailable to speak to us. So it was just the customers who were stranded at the entrances that we met in the morning when we went to the Avena office of the ECG. Okay,
thank you, Komla. And this is not just the picture here in Accra. In fact, in most parts of the country, in Kumasi, Cape Coast, Takrade, in most parts of the country, it's played out quite strongly. We're also learning that as we speak, the National Executive Council of the ECG Senior Staff Union are in a closed-door meeting deciding their next line of action. They already announced last week Friday that their action will last for 2 days, Friday and today, but they're meeting today to consider whether or not to extend their action beyond today and get some closure on this matter, so MEDA meets them at their point of the end. We also know that the PURC had made it clear that if the ECG management do not have the workers return to work, there will be sanctions that will be imposed on the ECG. Well, let's see what happens after today, whether or not the sanctions will kick in, even though we're learning from our grapevine sources that it's very possible that the strike can continue beyond today. We'll bring you more on the story as and when we have the updates for you.